Welcome back, everybody. We're diving deep today into secondary hypertension. It's high blood pressure that's caused by another medical condition. So we're going to explore what makes secondary hypertension different from that regular high blood pressure everyone thinks about, the essential hypertension.
Mm-hmm.
We'll look at what you should be watching out for in your patients and how to manage it effectively.
Secondary hypertension is really interesting because it's often overlooked. I think most people, when they think about high blood pressure, they think about the essential hypertension, the kind that we don't know what causes it.
Right.
But the key with secondary hypertension is that if we can find and treat that underlying condition, we can often cure it or at least significantly improve the blood pressure control.
So it's not just about managing the numbers you see.
Right.
It's about potentially solving the puzzle as to what's causing it.
Exactly. And while it's less common than essential hypertension, it still affects about 5 to 10% of adults with high blood pressure.
Okay, so 5 to 10%, that's not an insignificant number.
No, it's not.
So let's talk about these red flags for secondary hypertension. What should clinicians be thinking about when they see a patient with high blood pressure to make them think, maybe there's something else going on here?
Yeah. I think one of the biggest red flags is resistant hypertension. So this is when blood pressure remains high despite using 3 or more different medications, including a diuretic.
So they're on a good regimen.
They're on a good regimen, and the blood pressure is just not budging.
Yeah.
That's a sign that we need to start digging deeper.
So resistant hypertension, like a flashing neon sign, something else is going on.
Exactly.
What else? What other clues should we be looking for?
Another red flag is the sudden onset of hypertension, especially in younger patients. So those may be under the age of 30.
Okay.
And particularly if they don't have any of the typical risk factors. We also need to be really careful with patients who have very high blood pressure readings. So those that are 180 over 110 millimeters of mercury or higher.
Those definitely sound like situations where you want to hit the pause button and think twice. Are there other signs? Maybe some more subtle signs, like in the lab work or how their blood pressure behaves throughout the day that might give us a clue?
Absolutely. So one thing to keep an eye out for are electrolyte imbalances, particularly low potassium.
Okay.
Also, metabolic alkalosis can be associated with secondary hypertension.
Interesting.
And then if a patient's blood pressure doesn't follow that typical dipping pattern during sleep, meaning it stays high or even rises at night, that can also be another clue that there's something else driving it.
Okay, so really we need to be detectives here. We need to be paying attention to all the details.
Yeah, you said it.
So let's talk about the usual suspects behind secondary hypertension. What's kind of public enemy number one when it comes to the causes?
So I think the most common culprit is going to be kidney disease.
Okay.
And particularly those diseases that directly affect the kidneys themselves.
Okay.
So things like diabetic nephropathy or polycystic kidney disease.
Makes sense.
And in fact, over 2/3 of patients with advanced chronic kidney disease actually have hypertension.
That makes sense.
Yeah.
The kidneys play such a crucial role in regulating blood pressure. If they're not working properly, it's no surprise that hypertension is going to develop.
Exactly.
What else? What's another big category?
Another major category are endocrine disorders. So these are those caused by an overproduction of certain hormones.
Okay.
And the most common offender in this category is primary aldosteronism.
Primary aldosteronism.
This affects about 5% of all hypertensive patients, and it's caused by the adrenal glands producing too much aldosterone.
Okay.
Which is a hormone that regulates salt and water balance.
So basically a tiny little factory in your adrenal glands that's churning out aldosterone and messing things up.
That's a great way to put it.
What other endocrine disorders should we keep on our radar?
So a couple others to think about are pheochromocytoma, which is a tumor that produces adrenaline and noradrenaline.
Right.
And then Cushing's syndrome, which involves excess cortisol production.
So we've talked about kidney problems. We've talked about hormonal imbalances. What other big categories of causes do we need to be aware of?
So another important one is renovascular disease.
Okay.
And this is where the arteries that supply the kidneys become narrowed.
Okay.
You can kind of think about it like a kink in a garden hose.
Okay.
So you have this reduced blood flow to the kidneys, which in turn raises blood pressure.
Makes sense.
Renovascular disease affects about 1% of patients with hypertension.
Okay.
Now, in older adults, it's often caused by atherosclerosis,
Right.
the buildup of plaque in the arteries. But in younger women, particularly those under 50, it's often due to something called fibromuscular dysplasia.
Okay.
And that's a condition where there's abnormal cell growth in the artery walls.
So the age and the sex of the patient can provide clues about the potential cause. Are there any other age or sex-specific considerations that we should keep in mind?
Yeah, so in younger adults, excessive alcohol intake can contribute to hypertension. And then for younger women, birth control pills can also play a role in raising blood pressure.
So lifestyle factors and medications as well.
Right. Now let's talk about another important cause, particularly in younger adults, and that's coarctation of the aorta.
Okay.
And this is a narrowing of the aorta, so that's the main artery carrying blood from the heart.
Right.
And this narrowing restricts blood flow, leading to higher blood pressure in the upper body.
So sometimes it's not the kidneys themselves that are the issue, but the plumbing leading to and from the kidneys. Are there any other kind of culprits that fall outside these main categories?
Of course. We can't forget about obstructive sleep apnea.
Right.
When breathing is repeatedly interrupted during sleep, it can really put a strain on the cardiovascular system and contribute to hypertension.
Yeah, makes sense.
And then things like polycystic ovary syndrome can also be linked to high blood pressure.
So many different factors can be at play here.
Some very common medications that a lot of patients are on can contribute to high blood pressure.
What are some of those?
So things like non-steroidal anti-inflammatory drugs,
Okay.
decongestants, and even some antidepressants.
So it's not just what the patient might have, but what they might be taking.
Right.
Now let's talk about the actual diagnosis.
Yeah.
Once we suspect that somebody has secondary hypertension, do we just order every test under the sun?
That's a great question. I think it's very important to have a targeted approach to diagnosis.
Okay.
We don't want to just order a whole battery of tests.
Right.
Instead, we want to really focus on the tests that are most likely to reveal the underlying cause.
Okay.
And we do that based on the patient's history, their physical exam, and our suspicions.
So you're really playing detective, looking for clues to guide your investigation.
Exactly.
Can you give me some examples? Let's say you suspect kidney disease. What would you do?
So if we suspect kidney disease, we might start by checking their serum creatinine,
Okay.
their estimated glomerular filtration rate,
Okay.
and a urinalysis to just assess kidney function.
Okay. What about if you're thinking more along the lines of endocrine disorders like primary aldosteronism? What would you be looking for there?
So in that case, we would check the plasma aldosterone to renin activity ratio.
Okay.
And if that ratio is elevated, it suggests that the adrenal glands are overproducing aldosterone.
Interesting. Okay.
Very specific blood test.
Right. So we're really using very specific blood tests
Yeah.
to hone in on the culprit. What about renovascular disease? How do you investigate that?
So renal Doppler ultrasound is a good first-line imaging test
Okay.
to assess blood flow in the renal arteries.
Okay.
And if we see something suspicious on that ultrasound, we might order a CT angiogram or an MRI angiogram to get a more detailed look at the blood vessels. And that gives us a good look.
Yeah.
So untreated secondary hypertension carries a lot of the same risks as the essential hypertension.
Okay.
So things like heart disease, stroke, kidney damage.
The things we worry about.
Exactly. However, secondary hypertension can be a bit more aggressive and harder to control, meaning those complications can develop more quickly
Oh.
and be more severe.
So it's not just the same risks, it's potentially a faster timeline
Exactly.
and a more difficult course.
Exactly.
Because that underlying condition is driving that high blood pressure.
Exactly.
It can lead to more damage to those organs quickly.
Exactly. So we call that accelerated end organ damage.
Okay.
That means those complications like heart failure or kidney failure can develop more rapidly
Yeah.
and be much harder to manage.
That's scary. That's something to keep in mind. It
Yeah.
really underscores the importance of catching it early
Yes.
and treating it aggressively.
You got it. Early detection and addressing that root cause is key.
Yeah.
And that's how we're really going to improve the outcomes for these patients.
Hopefully everyone listening feels a little bit more confident in their ability to identify it and manage it effectively.
Yeah, absolutely. I think early detection and appropriate management are key. So keep those red flags in mind and never underestimate the power of a really thorough evaluation.
Yeah, be a detective, be an advocate for your patients, and you might uncover a treatable cause and make a real difference in their lives.
Exactly.
That's a great note to end on. Until next time, keep learning and keep diving deep.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.